Thank you for joining me today on Healthy Heart. This is Dr. Isaac Opoku-Asare. I'm trusting the Lord that you are safe and well. And today we're going to be talking about COVID quarantine and the associated cardiovascular effects. This is very important, and it is because probably never has the world, so many people in the world undergone such lockdown. I mean, countries with population of about 1.1 billion or so, I'm talking about India, all over the world, people are undergoing quarantine. It is something that we've never seen before, and it is important to know what are the benefits, what are the effects that it can get on the heart. But I want to address a few issues that have come up in terms of COVID. First of all, as we said that last time, one of the controversies that is sort of brewing now is the source of COVID. How did they get to us? As we said in our first broadcast on this particular discussion, we said that based on what we know, there is one thing that is established: the genetic sequence, or the genetic sequence of the COVID-19, which is what we are dealing with now. As we said, this is the seventh coronavirus that we know of. Is almost around 89 to about 95% similar to the coronavirus that is found in bats. So we believe that is established, that it came from bats. That is one thing that we know. The question is, how did it get to humans? That has been the controversy about it. And the controversy, initially the thought, from the published articles in New England Journal and other things, the thought was coming from the fact that from the bats, it got into other mammals, and from the mammals, it ended up, if you look at our diagram, from the mammals, it ended up, you're going to see that the bat, and from the bat, it moved from a mammal, and from there, it ultimately ended up in human beings. And we believe that came from the wet markets. The wet markets are places where, in China, where they have all manner of animals over there, and then they slaughter these animals right there, irrespective of whether it's a chicken. People have talked about anything you can think about, from chicken to snakes to anything. And he believes that it becomes an environment where viruses in certain animals can be transferred into other ones, and the human beings can consume them and cause problem. What is causing a little bit of controversy? I wouldn't say a little bit, of a whole lot of controversy, and it may come with probably a lot of we don't know whether it's going to be political or economic fallout, is the fact that we also know that in the same place where the virus originated, in China, there is a virology lab. This virology lab was reportedly set up after the SARS 2012 I'll call it epidemic that ravaged through Asia and all the way to Canada, which in my opinion doesn't compare to what we're going through now. And it is known that they started working on this lab. This lab has a coordinating activity with another lab in United States, specifically in Houston, Texas. And it is known that they were studying the SARS to see the relationships of the transmission. So people believe there are three theories that is out there. Number one, because the virology lab is close to the same area that the wet market is, there is a theory that wet market did not sell bats. So they did not sell bats. So people believe that it did not come from the wet market, but rather whilst they were doing the experiments. And it is believed that all the way down to these experiments were going on, it is sort of it went into a higher gear from 2015 all the way to 2008. And people in the United States reported that what they were doing was dangerous because of the fact that the precautions and the safety standards that needs to be in place to ensure that there is no transmission of this virus that they were studying into humans. So the idea is the fact that it's most likely that during the experiment the virus got into one of the workers there, and from there it affected the people in the area, and that is why we have this pandemic. And there have been a lot of suggestions that the attempt to blame the wet markers is an attempt by the Chinese government to prevent people from knowing that it came from the virology lab. So that is one of the things. Other people also talk about the fact that, okay, they believe that they developed a biological weapon. The two most plausible may be the fact that if they were working on it and it ended up being transmitted to somebody, or it went through the wet market system and got us here. I think the biggest question is dealing with it. I mean, wherever it came from, I believe that getting our hands on it and making sure that you don't get infected, that is the most important thing. So that is one of the things that is out there. But at the end of the day, whatever it is, our goal is to be able to bring this under control. So that is one of the controversies. But it doesn't change the idea that it still came from the bus, whether through the bus, through the lab, or the bus through the wet markets. That is where we are now. So that is the part about the source. So let us also talk about we talked about the mechanism the last time. You can look at the picture. And one of the things that we believe that this particular coronavirus does is that its ability to attach itself, what we call the ACE2. This is the medication that we've been talking about, that the medication for high blood pressure and also for the heart, that will encourage you not to stop taking, because initially, because the viruses are attached to the same receptor, there were concerns as to whether we should use those medications or not. But we now know that you shouldn't touch them. The recommendation is if you are using it, continue to use it. If we get any new update, we're going to let you know, and that is going to be very helpful. The picture is worth 1,000 words, and seeing the pictures will make you understand why we've been hammering on not stopping your heart medications. So let us now move on. We'll move on to the topic for today, and then after that, we'll come to a few updates that we have for you. With COVID-19, there is quarantine in various forms and in the strictest manner all over the world. I mean, as I said, probably several billions of people are under quarantine now. So what is essentially quarantine? I mean, it limits you at home, and it limits your ability to exercise, or it limits your ability to undertake activities of daily living. So number one, it limits your ability to exercise, right? So let me talk about a publication in Lancet that came recently for us to look at. I want to talk about the psychological effects based on the paper that was published in Lancet. So they looked at all cases of quarantine during the Ebola, through the SARS. We've had the SARS, we've had the Ebola, we have had the Middle Eastern coronavirus. So this has sort of informed us. So they looked at all these people who were quarantined. And there are a number of things that this particular article showed, that being quarantined can lead people to be frustrated. So if you are frustrated, don't worry. Know that this is normal and calm down. We are doing all these things that is good for everybody. And the longer you are quarantined, the longer sometimes, the worse these symptoms become, right? The paper also showed that being quarantined can lead to emotional disturbances like anger. So sometimes certain people that were not in close proximity and being at home, and not being able to go out, it can make you angry. So no doubt that you are beginning to see people protesting against quarantine. Another thing that it can also lead to, it is a sense of hopelessness and fear. So whenever people are quarantined, based on that publication, we may see these things in people, and no wonder we are seeing them all over the country in terms of protest and other things. So apart from either the political or the whatever reason is behind that, some of it is coming from the idea that the people are being quarantined, and that is just, these are the psychological impact. The sense of hopelessness is pretty. It's a very important thing that needs to be addressed. So, if you look at the publication in Lancet, we now know that the longer people are quarantined, I'm repeating this, the longer people are quarantined, the worse these emotional or psychological disturbances are. So, ideally, quarantine is a fine balance that people need to know in terms of how long it can go, because of these things, these emotional disturbances that was reported in the paper that was in Lancet. So how do you deal with it? So that is what I want to talk about, because if you are depressed, if you are angry, if you are frustrated, I mean, certain people may fight with their wives, some people may fight with their husbands. I believe that these are more or outpourings of the effects of quarantine that it seems to be coming from the paper that was published in Lancet. How do we deal with it? First of all, it is important that you get yourself informed. It is known that when people know and appreciate why quarantine is being enforced, they will deal with it better and make the psychological impact of the quarantine less. And let me say this, that all these things that we are doing is for the good of all of us as a nation and as individuals and as a family. So though these frustrations may be there, I want to encourage you that we are all in it together for the good of our family and everybody, to bring this nation and to bring the world out of it. So there are things that you can do to encourage you. The other thing is to get yourself involved in activities that will go a long way to help you to be able to deal with the situation better. I mean, I tell people that we always say that we don't have time. Now you have time on your hands. So if the book that you wanted to write, if there was a project that you wanted to do, this is the right time to do it. The interesting pattern of it is that it is seen that people who have one children seems to experience they seem to experience the psychological impact of quarantine much more than people who have a lot of children. I don't know why, but that is a pretty interesting concept. I don't know whether having one or just the one child brings because another part of the psychological issues here is also loneliness. People feel a sense of loneliness. So these things that we are seeing may be accounting for, these things that have been reported in the paper may be accounting for what we are seeing. And it is important, we are here to educate you so that when you see these things happening, you know that these are natural things that comes with quarantine, and it's not because you are going crazy. You need to relax. Things are going to be good and it's going to be fine. Actually, healthcare workers, if you are a healthcare worker and you are quarantined, the impact of quarantine is even higher in people, in healthcare workers, in terms of the things that we talked about, specifically the loneliness, the sense of helplessness, and the frustration. And the other thing that I believe that the government, our leaders are responding to that in terms of addressing the quarantine is a fear of economic loss. I believe that some of the stimulus packages and other things may go a long way to sort of calm people down with respect to fear of economic loss. So all these things are very important to be able to help you. I'm an interventional cardiologist and a vascular doctor. I'm not a psychiatrist, but my goal is to give you this information that I believe that is going to go a long way to help you to deal with it. So engage yourself in things that is going to help you. So let us talk about the cardiovascular effects. What are the cardiovascular effects? Because of quarantine, most people lose the activities that they routinely do in terms of physical activity. All adults, that is from the age of 18 all the way to what? All the way to 64, and even elderly people, the recommendation is that you must exercise 150 minutes a week, 150 minutes a week, which translates to 30 minutes of leisure time activity, or 75 minutes of vigorous activity, which is either swimming, running, or climbing stairs. These are all cycling at a fast pace. These are what we call vigorous activity. So you need 75 minutes of that. And you need 150 minutes of regular moderate intensity activity like walking, biking slowly. You need that. The issue is this. With quarantine, a lot of people have stopped that. And when you stop there is been studied. That is why I'm having this discussion. Once you stop this physical activity, a chain of reactions begin to occur. Your metabolism of your sugars begin to go down rapidly. And then the diabetes can develop in you. Because now you have taken with the concept of energy balance, have gone into energy disbalance. Why are we saying that? Because, number one, that we're now eating more and you are not exercising. And because you are not exercising, there is in, but there is no out. So, people who are quarantined, because of the lack of activity, it can lead to what? It can lead to weight loss, weight gain. So you're going to have weight gain. Exercise by itself improves the metabolism of your glucose. So if you have stopped exercising because of the quarantine, then look, these are the dangers that comes in. And remember this, once you are not exercising, the sugar is going up, the cholesterol is going up. And once the cholesterol and sugar goes up, it only leads to a situation where you end up with worsening blockages in the heart and in the rest of the body. So, when I was reading this, since this quarantine thing started, my own exercise has gone down. After reading the paper, I quickly went back to my basement and started my exercise. I said, "Ooh, nobody is exempted." Because quarantine can lead to significant reduction of your activities. And when it happens that way, then the other adverse cardiovascular events comes in. So it is important that if you are not exercising, people that go to the gym, people that go to other places, so people are allowed, even with this quarantine, you can still go into your neighborhood, walk 30 minutes and walk 30 minutes back. If you are in a state that you are required to cover your mouth with a mask, you do that. But it is very difficult for most of us to say that we cannot exercise 30 minutes a day when you are under quarantine. I believe we have time to do that. And most people are spending a whole lot of time on TV and on internet and social media. 2 hours, 3 hours, 4 hours. Somebody told me they are glued to the TV or social media. Please, cut 30 minutes of it. And use that time to exercise. Exercise also improves. It helps to deal with the psychological what? The psychological adverse events that quarantine brings in. The frustration, the sadness, and all those things. Exercise can lift you up. It's very important for you to do that. So there are many, 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 many benefits of exercising during quarantine. Those of you that have got treadmills at your home, please, this is the time. Some of us, the treadmill has become the place where we hang our towels and shirts and other things. Please remove them all and start exercising. Very important. The other thing I want to tell you is that, you see, continue to weigh yourself. In times of quarantine, is the time to weigh yourself because you may start putting on weight, and that is not good because of something that is going to happen. So let us talk about it. Now, even when you don't exercise, your muscles what we call atrophies. That means that the muscles become smaller and smaller. And after quarantine, a lot of people would like to go back to exercise. And that may be that and if they end up want to go back to their previous exercise regimen, like instead of starting slowly, they want to go back, that can lead to bad outcomes. That means what I'm saying is that can make people fall down, or people that is not good because you've ended up being deconditioned and you'll not be able to do that. So that is why you should not stop the exercise during this period, but you must continue the exercise. And if you have stopped the exercise, my admonition to you is the fact that you need to start the exercise slowly and then bring it back again. And what form of exercise is important? All of them are important, right? The aerobic exercises, which is either walking. If it's in your neighborhood, you can walk up and down, and that should be fine. If you have a treadmill, you can use it. If you have a basement in your house, you can go up and down, up and down, up and down. If you can do that, wherever you are, if you can do that up and down, not your regular work, up and down for 30 minutes, it still counts. Where you walk doesn't matter. Whether you're walking on the moon, the sun, the earth, your house, outside, the whole thing is that it should be a leisure time committed to doing the exercise. That is what makes the difference. And that is what we encourage you to do. And then continue to do that. Those who can do what we call isometric exercise, which is lifting up of weight and other things, it is also recommended. Make sure that you do it according to your body size and your strength. So combine both the aerobic exercise that I've talked about together with the isometric exercise during this time, and that is going to keep you in a proper energy balance that we seek to do, right? Because we know that when people are depressed, they eat more. So there is a tendency for you to go into energy disequilibrium. That will lead to more. I know somebody, right? When they are sad, they eat more. And that will make them what? Put on more weight. So the dangers of quarantine with respect to the heart are many. And that is why you need to know these principles and not to stop your exercise, right? And not to change the way you eat. We'll go into the aspects, the eating aspects or the diet aspects during quarantine next week. But it is important for us to deal with the exercise part, which is critical. Very, 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 very important for all of us to understand that. So what I would like to end with some of the updates that have come up and over the last week since we met over here. So we now have a data that was published in New England Journal with respect to treatment. And one of the things that we found, remember that we talked about 3 forms of treatment. We're talking about the hydroxychloroquine or the chloroquine plus azithromycin as one of the therapies. And then we're talking about remdesivir, which was used to treat patients with Ebola. And then we talked about the HIV medication, which is the lopinavir and the ritonavir. It looks like there's some data from China that shows that probably the HIV medication may not be that effective. But we had a publication in New England Journal. Once again, it's a very small number. This is not a randomized study. This is something that I believe that it's just a guide as at this time. They studied 62 patients, and they were able to analyze the data for 53 patients. And these are patients whose oxygen were like less than 94 watts breathing room air, and the results were pretty, I would say, pretty impressive, because for those patients that were on ventilator, as we talked about, being on ventilator is a bad sign of you dying or having a bad outcome. Almost 47% of these patients did well. So, which is very, very good, and it's something that I believe that it should be able to help us. All the doctors, especially, and the people that are taking care of these patients. So it's a small study where the compassionate use of remdesivir has been found to be helpful. There are many ongoing trials around the world now, and we hope that we'll be able to get some information about it to be able to help us to be able to move forward. Prevention is better than cure. I can tell you that. So we will strongly encourage you that all the things, the directives that have been put out there, we all should adhere to it. It is not easy to be quarantined, but I tell you, it is not easy to also be in the front line of taking care of patients with COVID, like me, right? It is even much more scary. But that is a call of a doctor. That is a call of an MA. That is a call of a nurse. That is a call of everybody, that we have to take care of those that are sick. The great work that our doctors and all the allied healthcare people are doing. But once again, do these things. We want to talk about the controversy pertaining to masks and some of the data that has been done to show why now there is a recommendation all over the country, probably about the use of masks. It is because now there have been some publication in New England Journal and other places showing that it may be helpful, especially if you talk a little louder, to protect other people from getting the virus. We used to think that probably the 6 feet is good, but some data may show that probably 8 feet may be better, because some of the aerosols can travel between 6 to 8 feet. And that is why it is important to use the mask in places. I mean, if this is voluntary, let me put it that way, but in certain states they've made it that way. I'm saying all these things so that you don't get frustrated. You don't. One of my patients told me that I'm going crazy. I needed to go out and get some air. I said, fine, now I understand. I know why he was going crazy. It's the quarantine. The quarantine is working them, right? But we are all in it together, and I believe that the numbers are looking good. I did not go over that, but when I say the numbers are looking good, it is very heartbreaking in terms of the death numbers. But we know that even in the hot areas, hospital admissions for COVID is getting lower compared to to where we started, and the rate, or that is the rate at which the infection was getting a lot of people, it seems to be slowing down in most places. So that is very good news. I am confident about this, that we as a nation, we as a family, we as a community, we shall overcome, and one day we'll have a reason to be happy to be members of this wonderful country and citizens of the world. God bless America. God bless you.